What's the difference between traditional liposuction and laser liposuction?
Traditional liposuction just involves, the cannula and a vacuum. And so I do awake liposuction. A lot of patients, they just do not want to be put asleep and they want another option. So awake lipo, you get some medications, kind of make you relax. You're awake the whole time. One of the biggest advantages for me doing awake is I can reposition you. When you're doing liposuction, it's all about vectors. So if you can imagine the flank or the waist, if you're laying flat, I can only approach that from one way. But if I can put you on your side, I can like really clean that out and get you that nice little curve. And so that's one of the biggest advantages of awake. And then also your recovery is a little bit faster. And then even if you're awake, you can also use various energy devices. And so laser lipo, supposedly for skin tightening, but I just feel like there's better options now.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right. We're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. I am so fascinated by this subject, liposuction. I'm one of those nerds who likes to watch the before and after videos.
No, I can't watch those. I mean, I like a before and after still image.
But you don't like the process video.
You've always tried to show me them too. I'm like, Selah, please.
Like, look at this, look at this.
No. But yeah, liposuction and body contouring, I feel like you see and hear about that all the time on social media, but you don't really know what it entails. And thank goodness we'll be joined today by a double board certified plastic surgeon from Atlanta, Georgia. He has his own practice there. It's called Nip and Tuck, and his name is Dr. Nicolas Jones. He's going to be joining us to educate us all on liposuction and body contouring.
Let's bring him in.
Yeah. So we're talking liposuction today with Dr. Nicolas Jones. Thank you so much for being here, Dr. Jones.
Thanks for having me.
Yes, we're so excited to learn about all things liposuction and body contouring.
Yeah, by the time we're done, you'll be a plastic surgeon.
Oh, I don't know about that.
No, you will.
This conversation isn't that long.
Yeah.
Did you bring your instruments?
No, everything you need to know, you can learn it right now.
Okay, well, teach us. Let's start with what is liposuction?
Liposuction is simply removal of fat using various cannulas. So we're just sucking out fat. Just
That's
like
it.
that.
I'm a doctor now.
Done. Okay,
That's it.
into the episode. There you go.
Yeah.
Okay, and what is body contouring?
So body contouring is just reshaping the body. And in order to reshape the body, you can use a plethora of instruments and techniques. And liposuction is probably like the main, the workhorse. And so with liposuction, I mean, it sounds really simple. I mean, if you go out into the cosmetic field, out into any place, you'll find that there'll be plastic surgeons doing this, dermatologists, internal medicine docs, OBGYNs. They all want a little piece of the action, but you want to make sure you go into someone who's skilled and actually knows what they're doing.
Speaking to that skill set, you are double board certified as a
Double.
plastic surgeon.
Double.
Double, and the founder of Nip and Tuck in Atlanta. What does that double board certification mean?
Yeah, so double board certified means that I completed 2 separate training residencies. So I'm board certified in general surgery, which is a 5-year program, and then I'm board certified in plastic surgery, which is a 3-year program. And so there's different tracks in order to become a plastic surgeon. You can go independent pathway, integrated. Integrated, you do a couple of years of general surgery mixed with some other specialties, and then the rest is all plastic surgery. For me, general surgery, I think gave me a foundation. I think, you're more mature, and you actually learn how to really take care of patients. Like I've spent some time in the ICU, spent some time taking care of cardiothoracic patients, transplant patients. So I think it just gives you a broader knowledge base. Nothing wrong with just going straight to plastic surgery. It just wasn't an option for me at the time.
What do you love most about being a plastic surgeon?
I would say actually it's the students, like the kids, like being able to give them some guidance, like if they show some interest in medicine, being able to just give them some information that may help them get to where they want in their career path. As far as the patients, for me, I just like interacting with them. I feel like once they become one of my patients, we're family, and just seeing them evolve, seeing them get their confidence back, seeing them walk out of the office happy, content with life, and just being more of who they naturally are.
And sometimes you help them get there with liposuction.
Yeah, absolutely.
What areas of the body does liposuction cover?
Every part.
Really?
Really?
Yeah, anywhere you have fat, you probably could get lipo done. So for me, I would say probably most common area, trunk, abdomen, flanks, arms, inner thighs. Some people even want fat removed from their butt, neck, chin, arms, bra roll.
Wow.
Yeah.
But it can be used for like the double chin type of thing.
It can help. It
liposuction?
can help. It can help with fat deposits of the chin and the neck. Yes.
Okay. Now, is it true with liposuction, if you get liposuction,
Okay.
that if you gain weight
Uh-huh.
after the procedure, that it can come, the fat will go in a different place on your body?
Yeah. So your fat cells, you're born with X amount of fat cells. So the amount you have is the amount you have. You won't make any more. But once you have liposuction, those cells that are removed, that's permanent. Now, however, the remaining cells, they can produce more. And so if you had liposuction, let's say you had liposuction of your abdomen and your weight fluctuates. If you gain weight, you're more likely to see more fat deposits in areas that weren't treated. And the reverse holds true. If you lose weight, the area where you had treated, it'll be more defined. And, the fat, that the areas that you didn't have treated will be more apparent.
That makes
So
sense.
the goal is, if you have lipo, maintain your weight. Like don't slip. I think if you can maintain your weight within 8 to 10 pounds, like as long as you don't go up too much, you should be fine.
Okay.
But when you have large fluctuations in your weight, it's going to affect your results.
Yeah, that makes sense. Should you go then when you're at your happy weight, so to speak, a weight that you can maintain?
You mean, is that when you
When you
should
should
get
get liposuction.
liposuction? Okay, yeah.
I have different approaches. So with this weight loss medication, it's kind of been a game changer. So I'll have patients who may not be great candidates when they come in. I'll put them on a weight loss medication, reassess, and then do the surgery. And then there's other patients, we may do lipo and then have them take the weight loss medication after. It just really depends. It's a case by case basis. But if I had to choose, I would say, hey, get to your ideal body weight or close to it, and then have surgery. Because there is limits on the amount of fat that can be removed during one operation. And then also, if you lose a significant amount of weight after you've had lipo, it's going to affect your result. So we want to get you the best possible result. So oftentimes that means losing the weight ahead of time.
Dr. Jones, you mentioned that really anywhere in your body that you have excess fat, you can have liposuction. But I would imagine that there are different techniques used on different parts of the body. Can you explain that?
Yes. So when I'm doing liposuction, there's a variety of cannulas. So there's more aggressive cannulas.
Cannulas. I don't know that word.
Cannula. It's the device that we use.
Oh,
to
the
suck out
instrument.
the-
Okay,
Yeah.
because I'm
Okay.
like, I
Yeah.
don't know.
So there's holes at the end of it. It's connected to a vacuum.
Oh, that's
and you
what
can
that's
suck the fat
called.
So
out.
it's literally
Cannula.
suctioning? Wow.
Yes.
Cannula. Okay.
And
No,
so-
I learned a new word.
So there are
Yeah.
various diameters.
Okay.
And then there's
Oh, that
some
makes
of them.
sense too.
Some of them have multiple holes. Some of them just have one hole, and then some of them have different patterns. And so there's more aggressive cannulas. If you're using a very aggressive cannula, you want to use it for the deep fat. Like, let's say, I mean, both of you look wonderful, but
Thank you.
I would
Thank
like
you.
a
I
little
will take it.
but let's say you wanted to have your neck liposuction. I would not use like a 5 millimeter cannula on your neck because it's more than likely it's going to cause contour irregularities.
Oh.
So when you go to that internal medicine doctor, no shade thrown at the internal medicine doctor, and they use these aggressive cannulas and your belly looks like
Wavy.
it looks wavy, it's probably because a person who it's not always the technician, but a lot of times they've been overly aggressive and they probably shouldn't have taken off everything. Yeah, because your fat also kind of serves as some insulation to your skin. So, you know, the surface, gliding surface.
So there's a difference too between subcutaneous fat and visceral fat, right?
Ah, look at her flexing her
Look at
muscles,
you.
literally and
Look at
figuratively.
you.
I mean,
Yeah,
you
that,
teed me up for that one.
there is.
That
So,
was very good, Selah.
so
Why, thank you.
So visceral fat, think of it internal. Like as a plastic surgeon, I have nothing to do with visceral fat. Visceral fat is around your organs, your liver, your intestines, your stomach. Can't do anything about that. So
Okay.
a lot of times patients come in, they say, "Hey doc, I want my belly flatter." Well, I can't flatten your belly because you have visceral fat. How do you fix that? Change your diet.
Diet, yeah.
Yeah.
What's the difference between traditional liposuction and laser liposuction?
Traditional liposuction just involves, you know, the cannula and a vacuum. Laser liposuction, I'm not like a big fan of it.
Why not?
I think it's kind of gimmicky. Like you have, there was this period of time where they had all these startups where you can get awake liposuction, and the laser was a part of it. Basically, they pass in the laser, which is an energy device, and is supposedly to tighten the skin. But today, I feel like there's much better technologies that actually do more skin tightening. And so I do awake liposuction. A lot of patients, they just do not want to be put asleep, and they want another option. So awake lipo, you get you get some medications, kind of make you relax. You're awake the whole time. One of the biggest advantages for me doing awake is I can reposition you. When you're doing liposuction, it's all about vectors. So if you can imagine the flank or the waist, if you're laying flat, I can only approach that from one way. But if I can put you on your side, I can like really clean it out and get you that nice little curve. And so that's one of the biggest advantages of awake. And then also your recovery is a little bit faster. And then even if you're awake, you can also use various energy devices. And so laser lipo, supposedly for skin tightening, but I just feel like there's better options now.
Do you think you get better results with traditional liposuction versus laser?
So the lipo is lipo.
Okay.
The laser is sort of something additive.
Oh,
Okay.
okay,
So
okay.
you're still doing the liposuction.
Oh, you
the
still have
same-
to. Oh,
Right.
okay, okay.
By the way, what's the most amount of fat you can take out in lipo
Safely.
Yeah.
safely? Yeah.
I think it depends on the state, but in Georgia, it's 5 liters. 5 liters is about 10 to 12 pounds.
Wow.
And the reason there's a limit is when you remove fat, you're also removing like fluid. You're also removing blood. I mean, you shouldn't have a lot of blood, but you can lose a substantial amount of blood. Like if I suction 12 liters out of you, you would have a drop in your hemoglobin.
Okay.
And so it's just for safety. Like if I suction that much out, you'll be volume depleted, and it's probably not safe for you to go home.
Who is a good candidate to have liposuction?
Great question. I would say someone who's healthy, has focal deposits of fat, and mild to moderate skin laxity. If you have a significant amount of skin laxity, liposuction does not address loose skin.
So if someone has liposuction, let's say they have awake liposuction, which you've mentioned, what does the recovery process timeline look like?
So one thing I always ask patients, what do they do for a living? Because I think your occupation definitely has an impact on how you're going to be, how you can recover and when you
Absolutely.
go back to work. But typically, lipo, whether it's awake or asleep, you probably want to give yourself at least 4 or 5 days
Oh,
to
that's
just
it.
kind of like 3 or 4 days to just to rest. And then during your recovery period, you have to wear this faja, or this garment, and it's for compression. It's to help out with swelling, and it's also to help out with your shape. And then I recommend patients wear those for about 2 to 3 months. As far as you getting back to all
Like
your
24 hours a day, or like how often
like
are you
all the time. Wear it
Really?
all the time. It's gonna help with your shape.
Sure.
And then as far as getting back to your normal activities, I would say strenuous activities, heavy lifting. So I usually say about 4 to 6 weeks.
Okay.
Okay.
And then you can kind of get back to the weightlifting, running, whatever. But you want to gradually kind of increase your load. Because if you go back too early, I've pretty much undermined your skin. So if this is your skin, I'm sucking out all this fat underneath. So if you go back to some strenuous activity, it's a shearing effect, which causes more inflammation, and fluid's gonna accumulate under your skin. You have hard areas, contour irregularities, and you're just gonna take a longer time to heal.
What do follow-up appointments look like? Like, am I coming in, let's say I had liposuction
Yeah.
yesterday,
Okay.
and is it next week you're seeing me again? Is it
Okay,
2 weeks later?
great.
How
We
often?
did your planks on Tuesday. You're gonna come back the next day, get your massage, a
Oh,
manual lymphatic drainage, and that's
That
really
sounds nice.
that's
is it?
really
Well,
to
maybe.
just help get some of the fluid out, and
Okay.
also just kind of help mold and help shape you. Get a couple of those. For my out of town patients, I usually have them stay about 3 or 4 days. Go back home. And then for the most part, you can do your follow ups virtually.
Oh, okay.
Yeah, for the most part, you can just take Tylenol, Motrin, and you should be fine.
Okay.
Well, that's great.
Is there a lot of swelling and bruising after liposuction?
That's a great question. It varies from patient to patient.
Sure.
Some patients swell up for months, and some patients, like I just had a patient who had like a abdominoplasty, lipo 360, BBL, and she came in the next day and her stomach was like completely flat. And
Wow.
this is an older patient, so that usually doesn't happen, but it really varies. I would say most people have some swelling for about 2 or 3 days, some weeks to months, but I would say after about 3 months, the way you look at that time is probably how you're gonna look long term.
Okay.
Would you say, being as moms like we are, if we have very young children, is that a horrible time to do this?
When is the ideal time for a mother? I would say when you have some like solidified some sort of support, because with the young toddlers, a lot of times you're gonna have to pick them up. They're gonna be all over you, so you need to have some support in place, and you need that. If it's just lipo, probably for like a week, where you can kind of just rest and be kind of out of the way.
But if you're doing the whole mommy
Yeah,
makeover,
if you're doing a mommy makeover and you have toddlers, it I would probably wait until they're older.
Well, because there are a lot of moms who are currently listening or watching this episode, and they're like, I mean, I want to get it done, but I want to be
how am I gonna do
realistic
this?
about what the recovery is going to be like. What does my support system look like so
Right.
that I can properly recover to get the results that I'm hoping to see?
Right.
Right.
You know?
Exactly.
Do people bring in a lot of like before and after, like Instagram or TikTok, like unrealistic expectations to you?
So yes,
Really?
there's this thing. It's called a wish pick. Yeah. So
wish
yeah. So they'll
Oh.
bring in a picture of like one of my patients that they saw, or some Instagram model, or some like Kim Kardashian.
Oh, by the way, are there touch-ups necessary sometimes?
Ooh, I was wondering the
Ooh.
same
I don't
thing.
think
Yeah.
Oh, yeah, revisions. Yeah, sometimes that's necessary.
Okay.
So, for example, let's say we've done your lipo and you come back 3 months later and you have this little area where it's a little bit uneven, or you may want a little bit more contouring. Yes, touch-ups can be necessary. I usually like to wait at least about 2 or 3 months before we decide to do that, because if you go back in immediately, everything's still going to be inflamed and it's going to be scarred up, and you're more likely to make things worse.
So you got to give it time. Yeah.
Let it heal up a little bit.
For sure. For sure.
Yeah.
Now, how much does liposuction cost? I'm sure it varies depending on the body part or the area that you're working on, but give me like a ballpark range.
So it varies. I think it depends on the area of the region. There's regional variances, and then there's also depends on who the surgeon is. I would say, in general, let's say you wanted to get lipo 360 with skin tightening. I would say that's probably like anywhere from $9,000 to $12,000, and then awake liposuction, the prices vary. But I would say, in general, you can expect to spend at least like $3,000 or $4,000, up to like $20,000.
All right, it's time for Ask the Expert. This is when
Okay,
our
let's
audience
go.
gets to ask you our expert questions.
Okay.
Here's the first one. I'm considering liposuction, but am nervous about potential dents or unevenness. You've touched on this, Dr. Jones. How can I ensure smooth, natural looking results?
So unfortunately, there isn't anything that they can do to ensure it. But as a patient after surgery, there are things that you can do. You can religiously wear your garment or your faja, get the massages, and just follow your surgeon's instructions.
Okay, this next person asks, how are incision scars typically hidden for the stomach and other areas? Will I be able to wear my bikini without them showing?
Great question. So whether it's awake or asleep, I always try to place the scars in places where it's not visible. That's not always possible, but for the abdomen, place one in the belly button, like within the belly button, and usually I place two in the groin area. So if you have on a bikini, you shouldn't really see the scar. If I'm doing the back, I usually use the armpits, but sometimes you have to put one like in the back and then also between the butt cheeks, in the gluteal cleft.
Okay, this person, Dr. Jones, wants to know, I think I need liposuction in multiple areas on my body. Where's the best place to start?
Great question. I think it just really depends on what's the priority. So if like I said, there is a maximum that we can take out, but for the most part, if you have less than 5 liters that we need to remove, you can safely have your whole body done.
Wow.
But it also depends on, what you do for a living, how much time you have to recover. And just as long as we fall within those parameters, probably can all be treated at once.
More important is the amount, it sounds like.
Yeah.
Right.
Right, okay. This person asks, can I get liposuction to get rid of my cankles?
You can.
Really?
So you
Wow.
can use lipo to suction out fat around your ankles, but it has to be fat. And also there's other causes of cankles. Like if you have lipidemia, if you have
Like swelling.
if you just have fluid swelling, like it's something like if you have a problem with your lymphatic circulation or your circulation overall, the lipo may not be a good option for you.
That makes sense.
Is liposuction permanent?
It is permanent. It is permanent. Like once you remove those fat cells, they're not going to come back. However, the fat cells that remain can produce fat. And so if you have large fluctuations in your weight, you will see a change.
Well, this has been so informative. I
informative.
did not know that you could get liposuction like really anywhere that you have fat. I really thought it was just designated for certain parts of the body only, right?
Right.
Dr. Jones, is there anything you want to add that we didn't touch on?
Yeah, sure. So if you're looking to have lipo, just make sure you do your homework. Learn about your surgeon. You need to really be comfortable with them. I feel like if you're going to have a surgery, you shouldn't be meeting your surgeon on the day of surgery. Like if you have not interacted with your surgeon, that's a red flag. Prior to surgery, prepare, make sure you have a caregiver, and just do your homework. Like make sure your surgeon is who he or she says they are. They need to have privileges at a hospital. They don't have privileges, that's concerning, because in the event that, even though it's lipo, in the event that you have a complication, you need to know that they have the ability to take care of you and manage your problems after. And also just be completely honest. Like if you've recently had lipo, if you've recently had a complication, if you take medications, you need to let your surgeon know because they can't make an informed decision on your behalf without having all the information.
And it's your health, so all
Yeah.
of that is so vital. Thank you so much, Dr. Jones.
Thank
Really
you.
enjoyed
Thank you,
conversing
Dr.
with you
Jones.
today.
Thank you.
Yeah.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.